be coming back as we continue today's conversation, but I'd like to invite Dr. Angela Mashford-Pringle to talk to us a little bit about what determinants of health are most critical for Indigenous peoples in the COVID-19 pandemic, and also how we're seeing some pandemic responses and policies are creating or reinforcing inequities in various Indigenous communities. Angela, off to you.
Well, kway to everyone. I hope you're having a good afternoon or morning, depending on where you are in the country. When I think about the determinants of health, everybody thinks about the 12 social determinants of health that Health Canada has, but they often forget about colonialism and racism. And I know Clay just spoke to this a bit, but you know, everything that's going on right now speaks to how colonization and racism and capitalism have actually led us to here. So it creates more inequities, specifically for anybody that's marginalized, like Indigenous people, because we're already faced with colonial policies and jurisdictional divides that you know, continually help us to suffer. And so when I think about that, we don't get all the basic necessities. And so if we're going to talk determinants of health, there's actually Indigenous determinants of health, and I see colonization, racism, and capitalism as three separate but connected determinants of health that Indigenous people face. Everybody faces them, but when you're marginalized and vulnerable, they become even more important in your life. What other determinants of health? Well, there's such a big long list of things that are causing this to be even worse. So water is my big one. I always go to water because I work with many communities, and what I'm finding out is that you know, they're having problems with their water. They can't use it to drink, nor can they use it to wash their hands. So based on the NGO, the non-government organization Water First, they're saying 2 of 5 Ontario First Nations are under boil advisories, and 1 in 5 in Canada. So when I think about that, and you think about non-Indigenous Canada, they would not stand for it being under a boil advisory, especially in the situation that we're in, because you couldn't do hand washing, you can't do your laundry, you can't do your dishes, you can't wash your hands. So these things are really important when we're talking about that. And even though we have the Safe Drinking Water First Nations Act that came in 2013, there's still 61 long-term water advisories across Canada, and they say they're not going to be completed until 2021. And you know, my fear is because of COVID, some of these projects will be stopped, or they would have maybe not even begun. So that could mean that there's tons of long-term either boil advisories or do not consume advisories that will stay in place for a lot longer than they should. And that's not speaking to the short-term advisory, so things that come on and go off. So this is a really, really big issue. Then the other issues that I often think about is, yes, we don't have the same amounts of employment or the same amounts of education. You know, people say, oh, the residential schools are over, but in my opinion, we have modern versions to residential schools when in Ontario, our flying communities in Northern Ontario have to fly out to Thunder Bay or to Timmins so that their 13 and 14-year-olds can get high school education. And to me, that's just another form of residential schools, and that means that, you know, they could have been out of community when this all began and had to struggle to get back to community before all of the border closings and flights went down. So, you know, you're disadvantaging First Nations children to get to their communities, and I think that's important to understand. Then in terms of access to healthcare, which is another social determinant of health, you know, some of our First Nations have hospitals, some of our First Nations have nursing stations, others are just telehealth on a regular basis. Now when you start to put into effect COVID-19, some of them don't have access to any, like to all of those resources because of the lockdowns, right? So if there's no flights coming and going from community, then it's really hard for them to get a doctor in. And in fact, that may be problematic when you think about some of the policies, which I'll talk about in a minute. But then when you're looking in urban areas, we still have the same issue. So when you're in an urban area, there's a lot of systemic racism against Indigenous people when they try to access health care. I can think of a recent, and I say recent, like it was in the last week, a community member who had a toothache here in the Toronto area, went to a local Toronto hospital because it was the middle of the night and she had broke a tooth and was in extreme pain, and they thought she was pain-seeking, looking for pain meds, and didn't want to treat her. So this is a huge, huge issue. And we have to think about how we can reverse some of this, or at least bring down the racism into a place where people can get the care they need. Then the next issue that comes to me is housing. While we're sitting in cities, and in cities it's not great for Indigenous people, we still have overcrowding in the cities. We still have 3.6% of our population that live in urban areas who are in overcrowded conditions. More than 1 in 5 are living in subsidized housing, and more than half of them are renting when only 29% of the non-Indigenous population rents. So this is a huge, disadvantage when we don't have any rent caps right now, so people are still having to pay rent. They often are working in the sales and service sectors or seasonal sectors, and they may not have the money to pay the rent. So this is huge, especially when you think of big cities like Winnipeg, where they have the largest urban Indigenous population. So how do we do that? And then when you think of on reserve, I've talked to a lot of fly-in communities, and they have quite a few homes where there's more than 15 people in say a 2-bedroom house. Doesn't sound all that horrible, but when you want to lay down to sleep and it's 2 bedrooms, you don't have a lot of places for people to lay down. There's definitely not places for people to self-isolate. Often they don't have indoor plumbing, so there's outhouses. So you're trekking in and out with a fever in COVID. That's, it's terribly difficult. The nursing stations don't have the ability to keep people there because they're often not that large to have any patients in there, nor would they want to have COVID patients in the halls when you have non-COVID community members who also need to access health care. So when we start talking about these inequities, you can start to see how one plays into the other, and that we're not doing a very good job of trying to fix these issues. Going to more towards the policy side of things, obviously, everything started with the British North America Act, and I know people always go, oh my God, well, that's so long ago, it was 1867. Well, under that, we split the jurisdictions, right? First Nations, Métis, and Inuit people went under the federal government responsibility, where healthcare and education went to the provinces. And so every time there's something like this where it's a health issue, but it's going to impact First Nations communities or Indigenous communities, we're finding that this is a huge, huge problem, because they want to back and forth whose responsibility it is. For example, with PPE, we have the Canadian Pandemic Influenza Plan that was created in 2006 and it's been updated. They were supposed to make sure that there was protective equipment for First Nations people in First Nations communities, and unfortunately, we haven't seen enough of it, if any, in some communities. And if they're getting it, it should have already been stockpiled before we had a pandemic, not during the pandemic or while we're at the crisis point of a pandemic. And that leads us to the point of why we had to get Jordan's Principle. I'm not going to go fully into what Jordan's Principle is, but just the fact that First Nations communities can invoke Jordan's Principle to ensure that the province and the feds are actually paying and just getting things done. Like, don't worry about who's going to pay for it right now. Let's just make sure that the protective gear is there. Let's make sure that the clean water is there. Let's make sure there's food sources for them. All this saying that's one issue, right? Like that comes from the Indian, and then we have the Indian Act. So the Indian Act is another big issue because it's always had restrictions in it, and these restrictions, they go from who's an Indian or a First Nations person, who imposes the restrictions. It lays out who can govern and who can't through band councils. And so these things all play a factor about who's getting the information, how they're getting the information, and when it goes out. So we're looking at these things and going, wait a second, we didn't create these problems, but we actually do need to make sure that somebody is looking at these issues. Some of the other policies right now that are really impacted, often they fly pregnant women, Indigenous women, out of community at 36 weeks, sometimes before. They're alone. They'll be staying in a hotel or another space that the Indigenous Services Canada has told them to go to. It doesn't give them money for food. It doesn't give them anybody to be with while they're sitting there. You have women just sitting, waiting to have a baby in an area where we know we have huge amounts of COVID outbreak. Then when they get home with baby, they won't be able to self-isolate because the houses are overcrowded. So these are another big, huge issue. And yes, a lot of communities are creating their own COVID responses, their own pandemic plans. Some of them had them in place. Some of them are just trying to get them back in place because they hadn't been used. And this is happening over and over again across communities. And again, going back to the hand washing, if you don't have water or you don't have enough water to brush your teeth and wash your hands and wash your clothes, it's going to be very, very easy for people to pass it from one person to another. And that's where I think the policies that we're creating in the South or in urban areas aren't working very well for First Nations people, because you can't do the things that you're supposed to be doing according to public health measures. So it's something that we have to think about. On top of all of that, we also have the inability to do our cultural ceremonies. So right now, actually since the beginning of March, they've been telling us not to do any sweat lodges and other ceremonies where we would be close together because of COVID, which means that communities are stopped and can't be doing as much as they would normally do. So this is also problematic. And then you think about the number of Indigenous people who are incarcerated in Canada, which is very high. For example, for Indigenous women in Canada, they make up 30% of all federal women inmates. So what happens with them? And now we're not allowed to go visit prisons, and how do we get all of those people the supports they need? And prisons, we know, can be outbreak areas just like long-term care homes. While there's protocols, protocols only work if everybody's on board and everybody's getting things done. So again, it's all about who's running the policies and how those policies are being implemented. Now, on top of all of that, the last thing I want to note is you might have language barriers, or you might have other issues going on in the community. For example, Kasheshwan is all in a flood zone. Right now, it's about to start our spring thaw and flooding, and the federal government's suggesting that those people be put in tents. It's still cold outside. Having people in tents in close quarters, including their elderly, which we would never dream of doing in the South. Can you imagine a long-term care home in a tent in their parking lot as opposed to within the building? This just shows the inequities and pushes them forward that much more. So that's where I think I'll stop.
Thank you, Angela. I think you're really highlighting the vast range of ways in which different systems interact in the lives of Indigenous peoples across this land. And I think you're sharing really powerful on-the-ground stories of how this is playing out. Some of the comments I'm seeing in the chat box is really the sense that as mainstream public health measures are being put in place, Indigenous peoples are not really being kept in mind, right? So the unique circumstances which communities may find themselves in were not a core part of how these mainstream public health measures are being placed. So thank you for that. You started by reminding us that colonialism, capitalism, and racism remain really critical determinants for Indigenous peoples. And I always like to think about the fact that, as you mentioned, Angela, these systems all interact in our life, and we all, experience different penalties or privileges depending on on our own individual social locations. So thanks for those reminders.